Thank you, Mr. Chairman.
Item number 9, AB 1235 Gibson, Medi-Cal Beneficiary Maintenance Needs, Home Upkeep Allowance and Transitional Personal Needs Funds. Good afternoon, Assembly Member. Welcome.
Good afternoon, Mr. Chair and members. First of all, let me just start off by accepting the committee amendments specified on page 5 of the committee analysis, and thank the staff for working with our team to make this a better bill. Well, thank you for giving me this opportunity to present Assembly Bill 1234, which seeks to improve quality of life and save the state long-term care costs by increasing the home upkeep allowance. Across the state of California, there are many residents who are eligible to leave a nursing facility, but are forced to stay indefinitely because they have nowhere to go. Currently, California provides the home upkeep allowance for maintaining of a home while in a facility to support the transition and the quality of life back to their own home and or community. However, this allowance is sufficient to maintain their home in California. Also, a report by the Commission on the California Health Human Services Agency recommends an increase in the allowance as a way to decrease the long-term costs. With me here today are individuals who will speak regarding this bill, in support of this bill. We have a representative from the Disability Rights of California, Ms. Connie Arnold.
I'm going to go first. Deborah Doctor from Disability Rights California.
Okay.
Okay. Thank you so much, Assemblyman. Thank you to the committee and especially to the committee staff who really dug into this issue. As Assemblyman Gibson said, there are people who are languishing in California nursing homes solely for lack of a home to go to. And this is documented by all the programs whose job it is to help people get out of nursing homes. The single biggest barrier is finding them housing. So we spend a lot of time talking about how are we going to find somebody housing, while with the other hand, we're causing people to lose their housing. So the people we're talking about are people who have income in addition or other than SSI. Some of them are actually middle class. They're on Medi-Cal in the nursing home only because they can't pay. Most people wouldn't be able to pay long-term care costs in a nursing home for very long. So when they go into the nursing home, and this is if they don't have a spouse in the community because there are separate rules for that, a single person goes into the nursing home, has $1,000 a month income or $1,500 or $2,000, and they're allowed to keep $35 for their personal needs allowance. And if by some miracle they find out about this home upkeep allowance, they get to keep $209 a month. Now, I don't know anybody whose home costs only $209 a month in California when we're talking about taxes, rent, mortgage, even if your home is paid for, HOA fees. So the result is they lose their homes. They stay in the nursing home at enormous cost to the state where they don't want to be, they don't have to be, and the law says they have a choice. So that's one group, and the second group that would help would be people who go into a facility and have already lost their homes. This bill would let them put aside some money out of their own income, up to a total of $7,500, so that they could get a home in the community to go to for a deposit, the kinds of things that we would all have to pay to get a home. If they're not able to leave the nursing facility, that money reverts back to the state. So there is no cost for those folks. So we're talking about a small state cost for a limited number of months versus the cost that we now incur of people staying in nursing homes for years unnecessarily against their wishes because they have no home to go to. So I respectfully ask for your support, and this is Ms. Connie Arnold who will speak about this firsthand.
Thank you. And we do have 3 minutes left for your testimony. Please proceed.
Thank you, and I'll try to be briefer than 3 minutes. My name is Connie Arnold. I'm a resident of Elk Grove, and I would be directly impacted as a person with a disability, as well as other seniors and veterans that would, for no fault of our own, end up in a nursing home and then find out all of our income is taken away for a share of cost to pay the nursing home. And if we were made aware of a home upkeep allowance of $209 a month, it wouldn't be enough to cover my homeowners association, my property taxes. If I was a renter, it wouldn't cover my rent. It wouldn't cover a mortgage. So these individuals, little old ladies, senior citizens, persons with disabilities, developmental disabilities, veterans, are losing our homes, which seems unjust and unfair that we managed to have a home and then be left to languish in a nursing home because now we don't have a home to return to, and because the home upkeep allowance is too low, and now we don't have any money that we can save to escape the nursing home to get back to a home in the community. So I really am proud that this author is sponsoring this bill and that Deborah Doctor is here testifying as well, and I would ask you and urge you for all the seniors and people with disabilities and developmental disabilities and veterans out there in this situation that you vote for this bill to increase the home upkeep allowance and allow people to continue living a life in the community. Thank you.
Thank you. Anyone else support? Opposition? Questions, comments? Seeing no questions or comments, moved by Senator Roth. Chair is recommending support. Would you like to close?
Senators, thank you very much once again. This will allow individuals who are in nursing home facilities to have some peace of mind when they return home and also be able to get some form of independence back. This bill has received bipartisan support in the Assembly, and I respectfully ask for an aye vote. Thank you very much.
Thank you. AB 1235 do pass as amended appropriations. Call the members, please.
Hernandez?
Aye.
Hernandez, aye. Nguyen? Hall?
I'm still thinking about it. Aye.
Hall, aye. Mitchell?
You can change your mind.
Monning? Nielsen? Nielsen, aye. Pan? Roth? Roth, aye. Wolk? Monning, aye.
Currently has 5. Do you want to change your mind or no? You just, okay, you'll think about it. It's enough to get out. We're going to still place that bill and call. We're going to move to item number 12, AB 1518, Assemblymember Brown.
Right.
Oh, okay. She can say me too.
Yeah. And Ms. Brown, apologize for the mix-up. There was a little misunderstanding. I understand you have a video as well?
Yes.
Okay.
It's not gonna, I'm gonna,
Do you want to let the video first, or do you want to do your presentation, or what do you want to do?
why don't we do the video first?
Okay, let's go ahead and do the video. Okay.
My name is Raul Carranza. I'm 25 years old. And I have muscular dystrophy. And as you can see, I'm completely ventilator dependent. And I require 24-hour nursing care to live my life independently. I'm sitting in my dorm at UCSD, where I'm studying political science, and I'll be graduating next year. I hope to go into public service so I can help others and give back to my community. When I was 21, I was studying at UCLA, and I found out that my nursing hours were being drastically cut, simply because I was turning 21. My needs had not changed, and my doctors wrote many letters asking Medi-Cal to reconsider their decision. They said that it would put my life at risk, and they were right. I had to come home and leave school to fight and get my hours back. I requested a fair hearing, and the administrative law judge ruled in my favor. However, the director of Medi-Cal overruled the decision and my hours were cut. For the next 3 years, I had to fight for what was essentially my life, and I spiraled into a deep depression. At 24, I finally got my hours restored, and I reapplied to go back to school. I was lucky because I had my family to support me. Had they not been there, I would have been forced into a nursing home, and I would not be alive today. Many people and families are not as lucky as I am. They're put into untenable situations where they have to choose between caring for their children or working. The law has not kept up with the needs of citizens, and it's time we start the process of changing that. That is why today I am asking you to vote yes on AB 1518 to make sure that no one has to go through what I went through again. Thank you.
Thank you, Assemblymember. Please proceed.
This is a very difficult, I hadn't seen that before, so forgive me. You know, nursing homes throughout the state really do provide a really important service to medically dependent individuals. However, oftentimes people who have lifelong medical needs choose to live in the community. This right was affirmed by the 1999 decision, Olmstead. Community life offers a measure of independence and an opportunity to self-direct the care. And that's why we have the nursing home acute facility Medicaid waivers. The problem in California is that we only have about 3,500 slots. And we are asked, this bill is asking to increase those slots an additional 5,000. I have with me Deborah Doctor, who will speak on this.
Thank you, Ms. Brown. Thank you, members of the committee and staff, for the thorough analysis of this bill. The young man that you just saw, Raul Carranza, lives in San Diego. He and his brother have the same disability. And he is an amazing young man. And the problems that I'm going to outline here are ones that he experienced himself. As he said, he dropped out of college, fought for 3 years, I'm proud to say with our help, and got his hours back. So the waiver is an important tool. It's supposed to present an alternative to institutional long-term care. But the way it's structured currently in California, it doesn't do that. And instead, it perpetuates what we call an institutional bias. It is much easier to get to a nursing home or other institution than it is to get services at home. And this waiver perpetuates that. And that's a way of doing business that hasn't made sense for a long time. In 25 days, we'll be celebrating the 25th anniversary of the Americans with Disabilities Act. And this bill embodies the spirit of the ADA, which requires that people be offered services in the most integrated setting. So the waiver has about 3,600 slots. That means when 3,600 people use the services, no more people get in. By contrast, the developmental disabilities waiver has 116,000 slots. The number of slots we have on the nursing facility waiver is not in any way related to need. It's just an amount that's been updated incrementally on the basis of legislation or litigation. We think it's time to look at the fact many sources tell us that 10 to 20,000 people in nursing homes could live at home with appropriate supports. And that's what we're talking about here. There are individual cost caps instead of an aggregate cost cap. That means that for the Carranza brothers, there's a parallel set of brothers in Berkeley, similar disabilities. This is true. The brothers in Berkeley are able to use a much lower amount, lower cost services, but the state's savings from them being below their waiver cap can't be used to offset the high costs of the Carranza brothers. And the levels of reimbursement, the waiver caps, are much lower. It's in your analysis than the institution. So the state pays $70,000 a year for somebody to be in a nursing home, and $48,000 a year is the most we'll pay to keep somebody with the same needs at home. This means that people stay in nursing homes at higher cost. So the rates are too low, the cost caps are individual, they should be aggregate, there are not enough slots. And Raul illustrates the last problem that I'll discuss, which is what we call the EPSDT cliff. He got services under a pediatric waiver up until the time he turned 21. He needs around-the-clock nursing. When he was about to turn 21, he and his family got a letter from the state that pretty much said, happy birthday, you're about to lose half your services. He didn't get better when he turned 21. He just lost his services. We call this the EPSDT cliff. And we believe that unless somebody gets better on their 21st birthday, that is, their situation changes, they should be entitled to the same services they had the day before. And what he's describing is he lost his services, and then he lost 3 productive years of his life when he had to drop out of college to fight his way back, which he had the strength, the amazing strength to do. So in his name and in recognition of the 25th anniversary of the Americans with Disabilities Act, I ask for your aye vote on this overdue bill to reform this waiver. Thank you very much.
Thank you. We have about a minute, 30 seconds left. Would you please proceed?
Yes, thank you. Again, my name is Connie Arnold, and I'm in support of this bill for all the people on the waivers. And I just want to add that I have a friend that's in the same situation as Raul that is coming up in August for this cliff. They already told her a few months ago that she's going to have her hours just drastically cut. She has spinal muscular atrophy, and she is a student at UC Berkeley, and she is doing a 2.5-month internship at a high-tech company in Mountain View. She managed to get. She's Chinese, and I'm proud of her. And I've been in support helping her both get on the IHO program from the beginning because I met her at a bank. And my mom said, stop saying hello to people with disabilities because you end up helping them all. But, you know, I'm trying to help her through fighting one battle after another. So after she gets her paycheck, come next month in July, she loses her SSI. She has to apply for the California Working Disabled Program to keep her Medi-Cal, to keep her IHSS and her IHO waiver. Then come August, when she's ready to go back to school, they're going to cut her hours in half, probably at least in half. So it's just a constant fight. And right now, she's just fighting Department of Rehab to get a lift to use the toilet at work. So, you know, it's just, and finding a place for her to stay for the 2.5-month internship, we had to find a motel with a roll-in shower and pay most of her earnings to the hotel so she could put this on her resume. So this is a real big struggle for people with disabilities, and this bill is going to help open up more slots for a waiver. And as a waiver user myself, I want to say that every time the provider wage goes up for in-home supportive services, they cut my hours. And I said, well, you're going to zero them out one day, because every time the wage goes up a few cents, they just cut my hours. And I need the help. They say, well, you're not, you know, you don't have this disability. You're not a quad, or you're not this, or you're not that. They'll say anything. And yet, this is a constant struggle for people with disabilities to stay living in the community. I really urge your support for this bill, and thank you for, if I went over a minute, I'm sorry.
Thank you, and you continue helping as many people as you want. Any other questions from any opposition? Any opposition? See no, yes, Senator Manning.
Well, more a comment than a question, but I just want to thank the author and the advocates for bringing this to our attention and moving it forward. And it sounds like a partial fix, and I'll be supporting it. But I think it provokes broader questions about how we prioritize some of our developmental services. So thank you for bringing it forward. You have a motion?
Yeah, it was motioned by Senator Roth. Chair is recommending an aye. Would you like to close?
I just respectfully ask for your aye vote, and I thank you very much for listening to these wonderful people who came out today.
Thank you. Item number 12, AB 1518, due pass to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Hall, aye. Mitchell. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Roth, aye. Wolk.
Currently has 6, enough to get out, but we're going to place that bill on call as well. We're at item number 10, AB 1305, Bonta, limitations on cost sharing, family coverage. Good afternoon, Mr. Chair.
Mr. Chair, excuse me?
I said good afternoon, Mr.
Good afternoon, Mr. Chair.
Mr. Chair? Mr. Chair.
Mr. Chair.
Mr. Chair. Like that Chevy Chase movie. Doctor? Doctor. 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 Doctor.
Darling of this. Stop. Thank you, Mr. Chair and Senators. AB 1305 prohibits health plans and insurers from giving a person a higher deductible or out-of-pocket cost sharing limit simply because the person is a member of a family. Specifically, the bill requires plans and insurers to include per individual deductibles and out-of-pocket limits for each individual within a family plan. Under this structure, if a family member becomes ill, rather than having to meet the entire family deductible or out-of-pocket limit, he or she will only have to reach the individual deductible or out-of-pocket limit for coverage to kick in. This will save some families thousands of dollars in extra out-of-pocket expenses and will protect consumers from having to pay more toward their care merely because they are in a family plan. AB 1305 aligns with regulations set by Covered California, which require plans and policies sold through the exchange to include per individual deductibles and out-of-pocket limits in family plans. This bill is also consistent with federal regulations, which require individual out-of-pocket limits in family plans, and then goes one step further to protect consumers by requiring individual deductibles in family plans. Finally, regarding the financial impact and impact on the market. According to the California Health Benefits Review Program, or CHBRP, almost 98% of enrollees throughout the state are already in plans or policies that comply with this bill. The remaining 2% are in high deductible health plans, which according to CHBRP would be the only type of plans affected by this bill. This bill will provide important protections to consumers and have a small impact on the market. With me today are a couple witnesses. I have Beth Capel representing Health Access, the sponsor of this bill, and Betsy Imholtz of Consumers Union to testify in support.
Beth Capel on behalf of Health Access California. We're pleased to be here today as the sponsor of this measure and in support of it, as we were the sponsor of your measure, Mr. Chair, to impose annual out-of-pocket limits in California, and in addition to impose limits on deductibles for small employer plans, a limit that at the time conformed to the federal guidance, but today goes beyond the federal guidance. As you know, many of the things we have done here in California improve on what the federal law is. The impetus behind this bill is simple. When a family has one of their members who has a serious illness, is the family on the hook for $6,600 for mom or $13,200 for mom when she gets cancer and dad and the kids don't need much health care? The real choice is whether families will end up paying twice as much when one of them gets sick, or whether their exposure is limited to what it would be when a single individual got sick. The same is true of what we're doing on deductibles. And again, the bill leaves in place the existing California law, which improves on federal law, to assure that deductibles in the small employer market are $2,000 and $4,000, but this puts in place a cost of living adjustment so those amounts can be adjusted over time. Thank you.
Good afternoon, Mr. Chairman and committee members. Betsy Umholtz from Consumers Union, which is the policy and advocacy arm of Consumer Reports. Health insurance is one of the most complicated products that a consumer has to shop for and understand. We've whittled away through the Affordable Care Act at many of the complexities and the gotchas in the health insurance marketplace, but one that remains would be taken care of this bill, and that is how deductibles and out-of-pocket limits apply to family policies. As described in the TBIRB analysis, it's a small segment of the insurance marketplace that is affected by this. Only 2% of all insureds in California have this problem in their policies through the high deductible policies, but it's an estimated 500,000 consumers, so it's a significant number of people who would be helped. It comes as a really unwelcome surprise to consumers with high deductible plans that if even one member of the family becomes quite ill or has an accident that results in very expensive care, they still may be paying twice the individual deductible, as Ms. Capel just described, and that's typically the individual deductible, typically twice the individual deductible is what the family deductible is. Most studies have shown that cost-sharing barriers can cause consumers to delay getting needed care, so by making these policies more affordable, this bill would have a dual effect, both making care more accessible for consumers and encouraging them to get care earlier when they need it because of that affordability. We urge your aye vote. Thank you.
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty in strong support of this important protection. Thank you.
Kimberly Chen with the California Pan-Ethnic Health Network, also in strong support.
Thank you. Anyone else in support?
Jasmine Gordon on behalf of the California Black Health Network in support.
Jerry Jeffrey representing the California Chronic Care Coalition in support.
Rebecca Gonzalez, National Association of Social Workers, California chapter in support.
Michael Young, California Labor Federation, also here in support.
Kathy Dressler on behalf of the Children's Partnership and also the California Children's Health Coverage Coalition, which includes Children Now, TCP, Children's Defense Fund, CCHI, the Children's Health Initiatives, United Ways of California, and PICO, California.
Jason Feifel with the California Public Interest Research Group in support.
Autumn Ogden with American Cancer Society Cancer Action Network, also in support.
Anyone else in support? Opposition?
Thank you, Mr. Chair and members. Nick Luizos on behalf of the California Association of Health Plans. We're actually not opposed to the bill. We don't have a position on it. We wanted to thank the author for delaying the embedded deductible provision of this bill for large employers. This delay is very helpful for our health plans from an operational perspective. Many of our plans are still interested in seeing a year-long delay, and we hope the door is open for that. We'd like to continue that discussion. Also, the most recent amends bring in the issue of deductible limitations in the small employer market. We just wanted to point out, while we appreciate the inflator and the search for a new inflator in those provisions, we want to point out the federal government has completely eliminated those deductible limitations. And so we hope to discuss that, those two issues and minor technical amendments to the bill. Thank you.
Thank you. Anyone else in opposition? Questions, comments? Seeing none, it's a motion by Senator Roth. Chair is recommending support. Would you like to close?
Thank you, Mr. Chair and Senators. As we know, the cost of health care is already too high for most of us. In particular, under current law, it's high for members of families. This closes a loophole and makes health care a little bit more affordable and removes a punishment now that currently exists for members of family plans. There's no opposition. I respectfully ask for your aye vote. Thank you for your consideration.
Thank you. Item number 10, AB 1305, due pass to appropriations. Call the members.
Hernandez?
Aye.
Hernandez, aye. Nguyen? Aye. Nguyen, aye. Hall? Aye. Hall, aye. Mitchell? Monning? Aye. Monning, aye. Nielsen? Aye. Nielsen, aye. Pan? Aye. Pan, aye. Roth? Aye. Roth, aye. Wolk?
Currently has 7. And that's enough to get out. And we're going to put that on call.
Thank you, Mr. Chair and Senators and staff.
Thank you. We're going to go ahead and lift the call on all the bills. And so everybody that's here can leave. If you call Senator Mitchell to come down. We're going to start off with item number 1, AB 503. Current vote count is 5-0. Due pass is amended. Judiciary, call the absent members.
Hall. Hall, aye. Mitchell. Pan. Pan, aye. Wolk.
Currently is 7-0. Hold on. We'll place that bill on call. Item number 2, AB 766, due pass appropriations, current vote count 5-0. Call the absent members.
Hall. Aye. Hall, aye. Mitchell. Pan. Aye. Pan, aye. Wolk. Got 7.
Current vote count is 7. We're going to place that bill on call. Item number 3, AB 1018, due pass to appropriations, current vote count is 5-0. Call the absent members.
Mitchell. Nielsen. Pan. Aye. Pan, aye. Wolk.
Current vote count is 6. Place that bill on call. Item number 4, AB 1117, due pass appropriations. Current vote count is 3-1. Call the absent members.
Hall. Aye. Hall, aye. Mitchell. Nielsen. Pan. Aye. Pan, aye. Wolk.
Current vote count 5-1. Place that bill on call. Item number 5, AB 1129, due pass to judiciary. Current vote count 5-0. Call the absent members.
Wynn. Wynn, aye. Mitchell. Pan. Aye. Pan, aye. Wolk.
Current vote count is 7-0. Place that bill on call. Item number 6, AB 1147, due pass is amended appropriations. Current vote count 5-0. Call the absent members.
Wynn. Aye. Wynn, aye. Mitchell. Pan. Aye. Pan, aye. Wolk.
Current vote count 7-0. Place that bill on call. Item number 7, AB 1194, due pass is amended appropriations. Current vote count 3-0. Call the absent members.
Wynn. Aye. Wynn, aye. Hall. Aye. Hall, aye. Mitchell. Nielsen. Pan. Aye. Pan, aye. Wolk.
Current vote count is 6-0. Place that bill on call. Item number 8, AB 1211, due pass to appropriations. Current vote count 5-0. Call the absent members.
Wynn. Aye. Wynn, aye. Mitchell. Pan. Aye. Pan, aye. Wolk.
Current vote count is 7-0. Place the bill on call. Item number 10, AB 1305, due pass appropriations. Current vote count is 7-0. Call the absent members.
Mitchell. Wolk.
Place it on call. She skipped 9.
Out of order.
She took it out of order. She'll get it next. No, she'll get it next. 7-0. Place the bill on call. Item number 9, AB 1235, due pass is amended appropriations. Current vote count is 5-0. Call the absent members.
Wynn. Aye. Wynn, aye. Mitchell. Pan. Aye. Pan, aye. Wolk.
Current vote count is 7-0. Place the bill on call. Item number 12, AB 1518, due pass to appropriations. Current vote count is 6-0. Call the absent members.
Wynn. Aye. Wynn, aye. Mitchell. Wolk.
Current vote count is 7-0. Place the bill on call. Item number 13, which is consent item, AB 1526. Call the absent members.
Mitchell. Pan. Aye. Pan, aye. Wolk.
Number 11?
We had 11, it was pulled.
Oh, 11 was pulled. It was pulled, okay. And put that bill on call. Okay, we'll go ahead and, I think you're done, you're all done, Dr. Pan? Yes. Okay, so we're going to start from the beginning again. Item number 1, AB 503, due pass the amendment of judiciary. Call the absent members.
Mitchell. Aye. Mitchell, aye. Wolk.
Current vote count is 8-0. That bill is out. Item number 2, AB 766, due pass appropriations. Current vote count is 7-0. Call the absent members.
Mitchell. Aye. Mitchell, aye. Wolk.
Current vote count is 8-0. That bill is out. Item number 3, AB 1018, due pass to appropriations. Current vote count is 6-0. Call the absent members.
Mitchell? Mitchell, I. Wolk?
Current vote count is 7-0. That bill is out. Item number 4, AB 1117, due pass appropriations. Current vote count is 5-1. Call the absent members.
Mitchell? Mitchell, I. Wolk?
Current vote count is 6-1. That bill is out. Item number 5, AB 1129, due pass to judiciary. Current vote count is 7-0. Call the absent members.
Mitchell? Mitchell, I. Wolk?
Current vote count is 8-0. That bill is out. Item number 6, AB 1147, due pass as amended to appropriations. Current vote count is 7-0. Call the absent members.
Mitchell? Mitchell, I. Wolk?
Current vote count is 8-0. That bill is out. Item number 7, AB 1194, due pass as amended to appropriations. Current vote count is 6-0. Call the absent members.
Mitchell? Mitchell, I. Wolk?
Current vote count is 7-0. That bill is out. Item number 8, AB 1211, due pass to appropriations. Current vote count is 7-0. Call the absent members.
Mitchell? Mitchell, I. Wolk?
Current vote count is 8-0. That bill is out. You can vote no if you want. Item number 9, AB 1235, due pass as amended to appropriations. Current vote count is 7-0. Call the absent members.
Mitchell? Mitchell, I. Wolk?
Current vote count is 8-0. That bill is out. Item number 10, AB 1305, due pass appropriations. Current vote count is 7-0. Call the absent members.
Mitchell? Mitchell, I. Wolk?
Current vote count is 8-0. That bill is out. Item number 12, AB 1518, due pass appropriations. Current vote count is 7-0. Call the absent members.
Mitchell? Mitchell, I. Wolk?
Current vote count is 8-0. Item number 13, this is the consent calendar, AB 1526. Call the absent members.
Mitchell? Mitchell, I. Wolk?
Current vote count is 8-0. That bill is out. Thank you. And that concludes the business of the day, and we are adjourned.